And we ask parents to journal because journaling is an evidence-based way to put painful and distressing memories to rest, especially if parents have endorsed PTSD symptoms in the pretest, like nightmare. Then journaling will make sure that the memories no longer chase them into the night. I'm going to start by giving you a brief overview of the guiding theory and research that supports journaling. The theory of inhibition and confrontation was developed by James Pennebaker. And the theory says that we tend to want to talk to others about stressful or traumatic events unless we don't feel comfortable talking about it due to fear of punishment, embarrassment, or disapproval. This is the inhibition part of the theory, and it actually takes work to hold back. Trying not to think about, trying not to feel, trying not to behave is a form of chronic stress because it takes so much work. And it takes a toll on our bodies. On the other hand, confrontation means thinking and or talking about traumatic memories and associated feelings. It turns out that forming a coherent, organized story about what happened is a way to give meaning to the event and manage the emotions associated with it. The beautiful thing about this theory is that there were multiple research studies, which is what makes a theory robust, so good at predicting outcomes. There's been research done with white-collar workers, widowers and widows, inmates, young people. This journaling research has been done with various groups. I'll explain to you why we do the journaling or how effective it is for our mental health and our well-being, our physical health. But I just want to acknowledge that Pennebaker says that people who talk about things over and over in the same ways aren't getting any better. There has to be growth or change in the way that we talk about our experiences. And he noticed that when people journaled, the more they wrote cause and effect words like because or realize or understand, the more they appeared to benefit. And also that they wrote about negative as well as positive emotion. So there was nothing repressed, or that there was plenty of positive words, but also a moderate number of negative emotion words. And so he wrote that what was really cool about the journaling is that for students who explored both their feelings and the traumatic events as they wrote, there was something happening in the brain. So there was congruence in brainwave activity between the left and the right hemispheres. So it indicated that both emotional and linguistic information was being processed and integrated simultaneously. This then, in terms of brain function, is what achieving integration means. We do build in the curriculum parents' resilience skills before we ask them to write about their traumatic event, so that they have skills to cope with the feelings that come up in the here and now. Discharging emotions is okay. It means they're not numb. They may choose to turn off their cameras. They may choose not to write during the 15 minutes that we set aside, and that's okay too. We hold the time and the space to write, but parents always have the option not to write. I like to say to parents, feel free to act in your best interests, including the right to pass. So I'm getting the signal to stop. More to come, I promise, about journaling.